So you have to put the X-sense dot onto the balance board, and then you can place the sensor on the balance board. When you've placed the sensor on the balance board, you have to place it backwards on the stool, and then you can ask your patient to sit on it. And you do that without the headset on, so you can ask your patient to feel what the balance board does, how you can move on it. Yes. So you can go to the front and to the back, yeah, to the left and to the right. But what you also can do is having more tilt on the pelvis, yes, on the other side, and upright position, and go to the front and the back and to the front again. So those are the different movements you can do on the balance board for the trunk. So to train on the balance board, you have to connect the X-sense dot by clicking on the tile, see that it is connected, then go again to the Bluetooth icon, click on the sensor, and then add it to the lowest part of the trunk on the pelvis. Again, calibrate the pose in a sitting position, and now it's going to tell you in your headset, please hold still. So now the sensor knows where it's placed, and I can go to my client and I can start the session. So I'm going to start with the range of motion environment, calibrate the sitting pose on the system, and then start the trunk range of motion. Please hold still, and now we can tilt on the, you can move on the balance board, left, yeah, and right. You can go forwards and backwards. And you can, yeah, have the little tilt with your pelvis. And it's normal that the range of motion on the balance board is smaller than when you place the sensor on the trunk, upper trunk. These movements we are going to use in the manta flow and the wobbly penguin. I'm going to start the manta flow right now. And again, the intermission shows the movement we just visualized. And of course, always a complement. So with the manta flow, you can train the flexion and extension and the lateral flexion by enhancing the range. You can have different interaction types, like the coins. The coins helps patients to move to the sides, left side, right side. And if it's random, then the software places the coins in the middle, to the left side, to the right side. If the patient is moving forward, then the manta flow, manta ray is going faster. And if the patient is leaning backwards, then the manta ray is slowing down. If I add the manta friend, that's the exercise which helps people to move forwards and backwards. So in it helps the patients to in the flexion and in the extension of the back. And it's to train the balance, so sometimes And now a second manta ray appears and you have to lean forwards or backwards, and when you can collect the coins, you're moving side by side with your manta friend. And the last exercise I want to show is the wobbly penguin. So I switch to the next exercise. And in this one you see the green line beyond the blue line is what you have been moving further. And that you can see that you can move a lot more than you thought. And when people have low back pains, they tend to move only one side and they hold their lower back stiff, and it helps to evoke the different kinds of movements patients normally fear. On this part you have to or tilt your head so the seagull can fly next to you, and with the orca you have to lean towards the orca, otherwise you get kicked off the ice plate. I can choose after several rounds with the seagulls that only orcas will still appear, and the side where the orca is going to, you have to lean towards. So I can also adjust the settings that it's a little bit easier to do. So we have to lean towards the orca, and that's the white of the blue stripe stays in the white area. Otherwise you fall off the ice plate. And of course you can also say, I'm only going to have the orcas coming from one direction, so only the left direction. So you only train one side instead of both sides. The other important part of this exercise is that if you have the seagulls in combination with the orcas, is that when the seagull is appearing, so you have to tilt your head. So now the seagull is coming again, that you have your patient upright on the balance board and he's only turning his head, only tilting his head. And then when the orcas comes, then he has to move his pelvis, and then you have a nice training on the different levels of the cervical spine and the lumbar spine in the same session. I'm going to stop the session, and then we can take the headset off again. And welcome back.